Welcome to this second video. In this video, I'm going to go over what you're being offered as far as health insurance is concerned. And so you will have the opportunity to enroll in this plan. And the first thing we will determine is going to be how much you would pay for it. Now, the standard plan that is being offered, that is where we're going to determine how much it is that it is going to cost. So in order for you to determine that, you got to click on the rate sheet. So that's going to pull this up. You want to scroll down to page 11. So when you're in page 11, you can see there's many different plans. However, the plan you want to look at is the Silver Tandem PPO 2045. So this is a PPO plan, and you want to determine your rate by your age. So depending on the age is how much the full price is going to be. Now, you're not going to pay that full amount. The company is going to pay 70% of that amount for you, and it is your responsibility to pay 30%. Now, that 30% would come out of your paycheck. If you get paid bi-weekly, then you would just divide that amount. So I'll give you an example. Let's say you are you're at age 26, $304 per month, then you would pay 30% of that amount. So if you want to calculate that, that's very simple. You get the 304.62, you multiply that by 0.3, and that's 30%. The company pays the other 70%. So you would only pay $91 per month if you are getting paid twice a week, or if you're getting paid bi-weekly. Sometimes it'll be twice a week, sometimes it'll be twice a month, sometimes it'll be 3 times a month, but it'll be right around $45 per paycheck. Unless you have 3 pay periods, then it would be less than that at that point. But that's essentially how you determine the rate, and you're going to go off this silver plan. Now, if you want to choose a different plan, I'm only going to explain the silver plan for you, because that's what's being offered. And so if you did want something that covers more, you would have to pay the difference yourself. So your employer will only cover 70% of the silver plan. If you want something more expensive, then it would still be whatever amount he would have paid for this silver plan, if that makes sense. Now, what does this silver plan look like? Well, before I go into that, if you just do not want to be enrolled in the health insurance plan, you have other insurance, you have Medi-Cal. Especially if you have Medi-Cal, then what you want to do is you want to click on this refusal of coverage form, and your supervisor asks your supervisor, they might have this on file so that they can give you. You just got to make sure you fill out all of this information, and if you're refusing coverage, you got to choose a reason why you are declining coverage. Now, whatever the reason is, you also need to decide who you're declining coverage for. And so myself and all my dependents, and then reason for declining coverage. And you may have other coverage from another employer. Maybe your spouse is employed and they have and you have the coverage through their job, or if you have other non-employer coverage, you might be covered under an individual plan. Or if you have Medi-Cal, this is the box that you would check, and you would just sign, date, and print your name and return this to your supervisor. That way they have it on file that you have other coverage. And so you also want to note, when you fill out your benefits information form, on the bottom here, there is a question asking whether or not you're refusing coverage. You want to select the option. If you are refusing coverage, click yes, and make sure it just tells you there to make sure you fill out that form. And pretty much this is what the coverage looks like under that plan. I'm going to give you a few examples. Hopefully this is clear. Okay, perfect. So again, this plan is we call it a silver full PPO plan. Now, what does PPO plan mean? Well, when you have a PPO plan, that just means that you have a network and you can go within the network, and you do not need a referral to go within the network. You can also go out of the network. I would not recommend going out of the network, because if you do go out of the network, you will pay a higher price, and I'll show you what I mean by that shortly. But make sure you stay within the network, and you should be fine, because you can pretty much predict your expenses if you're in the network. It's very important that when you go to a doctor, do not ask him if they will accept your insurance. You need to ask him if they're in the network for your insurance. Those are two very different things, because everybody's going to accept it, but that doesn't mean they're in the network. So if you see there's two columns here, when participating provider, those are people in the network, and then you have non-participating providers, those are people that are not in the network. Now in here you see it says calendar year medical deductible. Do not confuse this with a deductible on car insurance. It doesn't work the same. So on this plan, it's a $2,000 deductible, and you also have a pharmacy deductible, which is $200 per individual. You also have another amount that says calendar year out-of-pocket maximum, $7,550. That's in the network, and out of the network is $12,550. Now, you do not have to pay your deductible right away. There are certain services that you can get, and you only have to pay a copay, we call it. And so those services I will highlight, but I will explain how the deductible works and how the maximum out of pocket works. So if you go down here, you're going to see this. It says CYD, that means calendar year deductible. So any services that have that check mark, that means that you first have to pay that deductible before it starts paying, and after you pay your deductible, you will pay whatever's in this column. So for example, let's say you have to go get surgery. Well, the deductible applies to surgery. You will pay up to $2,000, and then after that you will pay 40% until you reach your $7,550, which is your maximum out of pocket. Essentially, the maximum out of pocket is your worst case scenario for that calendar year. And so once you reach that amount, it doesn't matter how much if you have to go to use services again, it doesn't matter how much they cost. Once you have reached $7,550 out of your pocket, you will pay zero. So even if you go in, have open heart surgery, if the open heart surgery is $100,000, you're basically gonna be capped off at $7,550. And if you go have another surgery that same year, then you don't pay anything because you've already reached that amount. However, most of the time you're not gonna be subject to the deductible, especially if you're just gonna go and get primary care doctor visits. If you're going to your primary care physician, you're only going to pay a $45 visit, and that's it. If you're going to your specialist, $70 visit, and that's it. Usually whatever they do at the visit is going to be included in your $45, so you're not going to get billed afterwards. The only way you would get billed afterwards is if you go and have some type of surgery that is not at the facility, or some other type of procedure. Like for example, let's say you go and have lab work done. Well, if you have lab work done, typically they're going to send you to a separate facility, and you're going to have the lab work done. However, there are some doctors' offices that do lab work there at their office, and so for that you would have a separate co-payment, and so just keep that in mind. But going out to a separate facility getting lab work done or an x-ray, let's say you go get an x-ray, you will pay a $45 copay for that. So you go to your doctor, you pay your $45 copay, then they send you, because you need an x-ray, you pay another $45, and that's all. You shouldn't get any other bills, of course, unless you go out of the network. Then at that point you would pay a very way higher amount than going in the network. Now you have this is $45 is for labs, and x-rays are $70. So you can see here it says laboratory services, pap includes a pap smear, $45. Outpatient department of a hospital, that's different than a lab work. That's if you're in the hospital, then at that point when you're in the hospital, typically deductible will apply and you are gonna pay that. But if you're just going in for an x-ray to a different, just another facility that you are sent to, you would pay only $70 and you will not have any other bills. Now when I say deductible and you're looking at these check marks, there's some services that the deductible applies to, but you only have to meet the deductible once. So once you have paid your $2,000, then even though, so if you go in and have surgery, you have already met your $2,000, if you go in and have another surgery, then you've already met your deductible. You don't have to pay for it again, if that makes sense. So you can go ahead and look over this chart and it'll show you all the procedures, or most of the procedures that require calendar year deductible, and the ones that only require a copay. And so if you do have any other questions, please feel free to send us a message. And as far as medications goes, you can see that for medications there's a $200 deductible, and the deductible will only apply for medications in tiers 2, 3, and 4. If they fall in tier 1, you only pay your co-payment, or the full price of the medication, whichever is cheaper. If the medication is $50, you only pay $20 because that's your copay. If it's $10, you should only pay $10, not $20. But other than that, that's pretty simple and to the point. Overall, this plan is a decent plan. A lot of people decide to go with a silver plan because it's not the most expensive plan, but it's a good medium happy plan where even if you have a big emergency, you are going to be capped off as so